Next topic, vitamin A. Vitamin A, think about pre-vitamin A being found in yellow, orange vegetables and fruits. Think about carotenoids, think about carrots. Pre-vitamin A should all be in our diets as part of having good, healthy vegetables and fruits in our diet. But pre-vitamin A is actually a chain that's about this long. Activated vitamin A requires us to cleave that in half. And there's great variation among the genetic diversity of people. Some people can't cleave that very well. There are other reasons why we might not be absorbing very well. So, vitamin A is considered to be vitamin A deficiency is considered to be a developing country issue. Public health people are studying vitamin A deficiency all over the world in developing countries. Let's say areas, Swaziland, Botswana, New Guinea, Fiji, and the like. No one looks at the United States because we're Americans. We're not deficient in anything, thank you very much. However, in the past 6 months, in our teeny little clinic, we have documented 35 people with low vitamin A levels. So someone said, oh, you're talking about a third world issue in a first world clinic. Yeah, that's a way of thinking about it, perhaps. No one looks at vitamin A, but we know vitamin A is critical for immune function, for gut health, bone health, eye health, skin health, hair health. Let's talk about bone health. Too little impairs our capacity to have a good living matrix for our coral reef. Too much looks like the same thing. Just like with vitamin D, you can't do a physical exam or you can't do kind of like some kind of energy read and know, I bet your cholesterol is about 230. No, you can't do that. You have to measure. Same thing, so just like we have to measure vitamin A, I believe we have to measure vitamin D. Good thing is to say, yes, let's make sure we've got lots of yellow and orange vegetables in our diet. I think sweet potatoes are becoming more and more popular, yams, but carrots, the whole like, these things are all important, easily done. Oh, it's easily measured. Okay, so when I mention about vitamin A, here's where I get a little bit geeky. So please pardon me. I'm going to show that this is a pre-vitamin A. It's called a carotene. There are about 600 carotenoids in our body or in a good diet, or at least have been measured by scientists. You might look at a multivitamin and say, oh, it contains beta-carotene, 1 of 600. We recommend that we focus on diet first, but multivitamins will often have carotenoids. Carotenoids then are cleaved in half to become activated vitamin A's. And there's a lot of reasons why that might not happen. We can't just presume it will happen. At least judging from our little sample in a small clinic in little Minneapolis, we can say it appears to be a very big issue, a very important issue. Clues might include severe acne during high school. Clues can include GI dysfunctions of various sorts, easy enough to measure.